This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Today's episode is sponsored by Walk the Ridge. We can all have different opinions and views, but when it causes underlying tension and stressful communication, it impacts productivity, management, and even customer results. Walk the Ridge is a fast-growing movement for greater civility. Many people wear and gift our reminder wristbands because they work. You don't have to change your views to be a better communicator with others. Go to walktheridge.org and gift some bands today. If you join for free on our homepage, you'll get up to 15% off for your very first order. Walktheridge.org. That's walktheridge.org. Walk the Ridge, building circles of civility. HC1.com is a healthcare CRM company whose platform has been adopted across more than 1,200 clients, including labs, post-acute care facilities, and health systems. The company's top-rated by both Frost & Sullivan as well as KLAS. On today's show, we have the CEO of this award-winning solution, Brad Bostic. Brad, I want to thank you so much for coming on to Red Hot Healthcare. We just really appreciate you making the time for us today.
Thanks for having me on, Steve.
I want to go ahead and jump right on in, Brad. I've done quite a bit of research into HC1.com. I'm really impressed with the website. I know you started the company in 2011, and just on a 30,000-foot sort of view here, take the audience and myself through HC1's platform and the problems that it solves for.
Happy to do that, Steve. So here at HC1.com, we have a very important mission. And that is, we are here because we're intent upon unlocking answers to solve healthcare's biggest challenges. The first is healthcare providers and diagnostic entities are the backbone for healthcare. And they're being faced with some really significant changes to the healthcare landscape that they need to accommodate in order to successfully operate and serve other providers in these health networks as well as patients moving forward in a more personalized way. So a major challenge that HC1 is focusing on through our HC1 CRM and our market intelligence HC1 provider view solution is how can these healthcare providers more efficiently connect to other referral sources to allow them to grow the number of people that they can serve with their healthcare offerings. And then ultimately, as they increase those profitable referrals, we help them deliver a more personalized service level so that they can continuously offer the quality that's expected in today's much more competitive healthcare environment. Now, in addition to that, we are also looking at solving major problems that go more broadly into the public health sphere. So as we're working, for example, with thousands of medical laboratories across the country that are using the HC1 platform to better engage the providers and patients they serve, we're also processing that data and applying algorithms to go identify insights that can allow you to go address very critical healthcare issues, including the opioid epidemic. We all know that the opioid epidemic is something that is getting headlines, and it's for good reason. What's happening today has been very reactive in terms of trying to address that epidemic. We're using data transformed into a really rich healthcare matrix that allows you to understand relationships and behaviors so that you can drive positive change. And specifically with the opioid epidemic, we can allow you to understand what the specific drugs are that people are putting in their systems and testing positive for in a geographic region anywhere across the country, down to the zip code or the county level. And we see this as a way to truly solve a major problem that our country is grappling with.
Essentially what you're saying is that you're able to tap into nationally, I suppose, most, if not all, the people that are legitimately taking opioid medications and then you graph them on a map. And then you're able to go in and sort of color shade that so you'd know, I guess, what counties or what areas of states and of the country are harder hit.
That's one really good example. So there are a number of initiatives that are aiming at curbing opioid misuse and abuse. One of those examples is what's called a prescription drug monitoring program, which almost all the states have one of those set up. And the goal there is when prescribing is happening for an opioid, to make sure that you're prescribing to somebody who hasn't been around to a lot of other providers also getting those prescriptions because they might not be using that appropriately. And that's been reducing the amount of legitimate prescribing and dispensing at the point of care where you're engaging with a healthcare provider. And that's just one part of how opioids, though, are getting into the population, as I think you probably would know. And so the key with the HC1 opioid dashboard is to pick up the story beyond what's getting prescribed and dispensed and start filling in that gap in terms of what drugs are people actually taking, what are they actually putting in their bodies. And so it does express this information in a heat map type of format, as you were describing. So I can go and look at, for example, the state of Indiana and see a specific county that is a much darker red color, double click on that and get deeper into seeing what are the drugs that are showing up in that area. And are those showing up through workplace testing? Are they showing up through pain management testing? Are they coming through some kind of a criminal justice type of a source? It is not the case that the system is tapping into every single test, that's happening anywhere, but it is getting a statistically significant view into the drugs that are being used. And it's applying algorithms to that and using machine learning and artificial intelligence to gain insight into does this appear to be appropriate or not? Does this appear to be positivity that would tie to an appropriate pain management example? Or is this something where it's a red flag that could ultimately lead to needle sharing and the spread of communicable diseases like HIV? So the goal is to start zeroing in through these heat maps and these predictive capabilities on what could be coming so you can go institute an intervention, let's say a needle exchange program or an additional treatment center, so you can become more proactive and get ahead of these issues before they really hit you so hard. And then in addition to that, as I'm investing into public health programs, let's say, for example, at the state level, to be able to measure the impact of those programs, you really need the ability to see this insight in more of a live manner. Because if I'm, let's say, investing into new treatment centers, but I can't see whether or not the amount of drug usage is decreasing, how do I really determine whether or not that's working? So those are some of the key ways that this is applied.
Interesting. And you mentioned a bit about machine learning and technology in your platform. And from what I saw on the opioid webinar that I found on your site, it sort of looks as though like you're bridging the gap between the prescribed opioids and then what the consequences are from taking the medication. Maybe you can explain a bit more about how the machine learning in your platform sort of connects both sides of that.
Sure. Well, the first step is to have a view that gives you insight on the way drugs are being used. You need to normalize that information or you aren't able to actually run any sort of meaningful analytics. So in other words, the way that a given test is documented in a result within a given lab information system differs from one location to the next. So the first step with our machine learning is it actually maps all of this data that's coming from thousands of different locations. We're talking about billions of clinical results, and it organizes them in a way where now you can start running the kinds of reports and analytics to start discerning what's going on. What are the trends? So that's kind of the first step. But getting deeper into this, it's looking at the correlations between what the data is telling you about what's getting prescribed and dispensed versus what's showing up in people's bodies across the population, and then ultimately how that is tying to these consequences. So it's almost like you've got the ability to have an unlimited number of people who are smart, constantly combing through this and finding new correlations. So I can look at the data through the machine learning, identify that when you see a significant increase in fentanyl usage in this type of demographic, that will likely be followed by this other type of health consequence. It's almost like having a weather map and then the ability to get the forecast. And so that's what the machine learning is mainly helping with, is what is the forecast of where this is headed and what impact it's going to have? And then how do I take preventative action and have interventions that allow me to move things back in a better direction?
So I've got a question about this, just off the top of my head here. You tie in with a lot of different labs. I know that you do have health systems, you do have providers that are your clients. Certainly you don't have providers, all across the country. You don't have thousands of providers, thousands of hospitals, at least not yet. What if somebody goes into one of these labs and they get the actual lab tests and you're able to, let's say, flag them and say, oh, they're taking opioids or they're taking this drug. If you don't have the electronic health record from that lab because you don't have the patient's provider as your client currently, how can you tie those two together?
Well, there's a diagnosis code that accompanies a lab order that allows you to understand why that test was actually being run. So it allows you to know, is this somebody who is potentially in a pain management regimen or the like. But the reality is we do have customers across the nation, and we do have relationships with those customers that allow them to utilize individually identifiable information to better serve their patient populations. So in the case of, let's say it is a pain management setting, HC1's helping you see the analysis at the level of care that allows you to better serve that individual patient and determine what really should be prescribed to them, or if they need some kind of care management to help them, or maybe there are signs that they might need treatment. Those things can happen, and that action can be driven by HC1 at the individual provider level. But those are in the relationships where the individual healthcare organization, let's say the lab or a post-acute care organization, they're running our platform to help them better manage those relationships. And that gets to the heart of healthcare relationship management. And that's all bound under a business associates agreement, and it follows all the HIPAA regulations and actually goes well beyond what HIPAA even requires. So you keep all that information. It's very sensitive, individually identifiable, only made available within that more closed system. But then in addition to that, you've got this broader public health need that's more about how to create the policies and allocate the resources that are required to shape the direction of the use of these drugs in any given geography. In that level, like for example, where the state of Indiana subscribes to the HC1 opioid dashboard, they aren't accessing that to see a specific person in terms of the patient and who they are that is using a given drug. What they're actually seeing instead is, in this specific geography that's served by these specific providers, these are the trends. So I can understand that people in this demographic who have these certain attributes are showing up with this level of positivity of these drugs. And all of a sudden you see, oh, wow, we've got a very high spike in fentanyl, for example. We'd better get more squad cars equipped with Narcan so that they can help deal with somebody if they have an overdose. These are the sorts of things that you're doing with this at that level. And by no means do we have perfect visibility into everything. But if you equate it over to, for example, like Nielsen ratings, where you're trying to understand what television programs people are watching, that's based on like 500 television sets. It's pretty fascinating how small that is. In this case, you're actually seeing data points that span more than 5.2 billion clinical results across more than 52 million individuals that are part of the HC1 network of information at this point. And it's across all of the providers in the country that have NPI numbers are linked into this data set as well. So it is very comprehensive, relatively speaking, and really dwarfs anything else that's out there that could give you this kind of insight.
Do you tap into companies like Change Healthcare? Do you have relationships with them where they have pretty much all the payer data? It's backward facing in terms of or backward looking in terms of claims, but they're able to actually get feeds from all the payers nationally with their claims data.
We do have relationships that give us access to all of the CMS data, as well as a significant majority of all the commercial claims information as well. As you pointed out, it's rear view mirror facing, but we're able to get it as current as possible. And so we do tie that type of insight into our solution. In fact, the way that the providers who are using our HC1 CRM, the way they're able to identify the other organizations that could be referring to them is through our HC1 provider view solution that's all really based on the analysis of those claims. And so that's very instructive to know, okay, well, here's the physician who's doing the knee replacements. That's where I'm going to focus my skilled nursing activity to serve that individual, or the same kind of thing holds true for any of the diagnostic lab testing. So the answer is yes. And then we're very data hungry, to be sure. So we're continuously looking at places to not only incorporate more classically associated healthcare data, but also things like socioeconomics and the social determinants of health that really have an impact on these models. Because what we've all been learning here over the past 5 years or so is that the basic look at just what's happening with somebody when they enter into a healthcare setting is not truly what's needed to begin gaining the full picture to drive a more proactive approach to healthcare. It really starts way outside of just those specific episodes. So we're definitely infusing a variety of different data sets into this so that we can understand these relationships and behaviors in a richer manner and drive positive change more effectively.
I'd like you to take the audience, if you could, Brad, through how HC1 is working through the relationships between the EHR and the lab and path services, which often have data which doesn't easily marry up to those EHRs.
The vast majority of healthcare decisions are informed by diagnostic lab information. And within the diagnostic lab data that historically has just been flowing into the LIS system, there's an incredible opportunity to more fully understand what's happening across the healthcare setting with both the way that providers are engaging, physicians are engaging, what they're doing, what's working, what's not working, and also go all the way down to the individual patient level to really see what's happening with their overall health. Because whether you're going in to just have a physical and you get the standard battery of tests there, or you're going in because you have symptoms that indicate there might be something more serious wrong with you, that's always running through the lab in terms of gaining a lot of data. And so what we focus on with the labs who partner with HC1 is the fact that healthcare is all about people. So when you look at the lab data, you need to, in order to better manage a patient population and increase quality, decrease overall cost, you need to consider all of this lab data in the context of the people who are being impacted, which, believe it or not, the way that lab information systems have traditionally dealt with lab data, they bring in an order that has some kind of an order number and it's associated with a physician. And if they get 5 more orders from that physician on the same patient, all of that information ends up siloed in the lab information system.
Right.
It's all listed under the provider, but it doesn't even contemplate the longitudinal view of what's happening with those patients.
Yeah.
So what we're doing is using our advanced integration technology to not just process the data and try to, marry it with something else. We're initially taking it and stripping out all the gold that relates to the people who are being addressed. So who is the provider? What was the location that this test was ordered? Which gives you some pretty interesting information. What was the diagnosis code? What was the test that was actually ordered? What are the demographics of the patient? So on and so forth. And then ultimately, what are the results that come back through? And the way that this concept is associated with the CRM concept is that you now have the ability to look at these profiles in a very intuitive manner to understand what's happening with these different relationships. With this provider, who are all the people that they've run tests on, which means that they've actually served those people. And then downstream, what kinds of outcomes are you starting to see? And we go beyond the standard clinical data all the way into the molecular data as well. So while we're broad across tens of millions of individuals, we also go very deep into, okay, in these specific cases, here are the molecular data, here's the genotype, phenotype. So what we're constructing in HC1 is this unprecedented set of insights about these relationships and behaviors, which allows you then to better manage your patient population at scale. And then because it's a CRM construct, it has all the ability to drive action and accountability across that environment. So when we identify there's a critical result that requires immediate action, the HC1 platform generates the alert and drives the workflow to go make sure that communication is happening to address the issue. So it's really a full system of engagement that begins to immediately take the insight from the lab that's organized now in these rich interconnected profiles and drives action based on that. And that's why what we do is so much more valuable and so differentiated relative to, say, like a dashboard. You can purchase many different dashboards from many different places, and those are valuable and needed as well. It's just a different kind of value equation. HC1 is much more about driving the action and accountability based on this insight that truly improves healthcare quality and makes it easy for the healthcare organization to gain that value without having to become technical experts on it, because the solution already delivers the end result that they're looking for.
We can all have different opinions and views, but when it causes underlying tension and stressful communication, it impacts productivity, management, and even customer results. Walk the Ridge is a fast-growing movement for greater civility. Many people wear and gift our reminder wristbands because they work. You don't have to change your views to be a better communicator with others. Go to walktheridge.org and gift some bands today. If you join for free on our homepage, you'll get up to 15% off for your very first order. Walktheridge.org. That's walktheridge.org. Walk the Ridge, building circles of civility. You and I both just came back from HIMSS 18, and we had terrific time down there. But one of the things I noticed in walking through the many exhibit halls, the city as it were, is there's a lot of also-ands. There's a lot of EHRs or EHR vendors, and there seems to be a lot of companies that are commoditized. So they offer maybe some different looks, some different features, but a lot of them do the same thing. For many CIOs and for many health systems that are purchasing these days from vendors, it not only becomes very confusing, but in many cases, one of the things that it does is it extends out that sales cycle, as you probably know. So a normal sales cycle to go, let's say, in a health system from pilot to actual enterprise release, where they go in and say, we're going with you, might be anywhere from 18 to 24 months. It's a super long sales cycle. And my question would be to you, what have been your biggest challenges in working through that sales cycle with health systems?
So one of the big differences between what HC1 is delivering in its value proposition and what you would experience with an electronic medical record is that to put in a new electronic medical record, it involves tearing out your other one and going through all of the change management of all the people that you have in your organization to run in a different process. It's very difficult to do that. And that's why you also see that these systems will continue to be static in a given health system or provider environment for many years, because it's just so hard to change. What HC1 provides doesn't typically rip out anything else that you already have. It actually ends up becoming an overlay that unifies these different siloed systems and organizes that information in these profiles to help you engage better. So it actually allows you to amplify the value of all this data that you've been amassing and use it in a way that truly delivers on the promise of reducing cost and increasing quality in healthcare in a very measurable way. So you would find in our space where we're delivering on this more of an overlay that enables a higher level of engagement to solve really critical business issues that are pressing right now, that you're going to see a much faster process of adoption. And also, as a true cloud solution that is software as a service, it's able to scale up and down. So we have many customers that will start out with one of our solutions, like Sales and Service Advantage, get that activated and running within 60 days of signing their agreement, start getting value from that, and then ultimately expanding into some of our other offerings like lab test and blood utilization, or so on. So the sales cycles are much, much shorter for an HC1 solution than you would typically see with more of a back office clinical system like an EMR.
I mean, there's a lot of solutions that overlay over EMR. I mean, that sort of is the way everything is seemingly being served up now anyway. But because you have a blend of the CRM as well as the analytics piece that you do, and certainly you're working with the labs tied in, do you find that there's plenty of competition in the space that you're in? Or do you find that you're sort of redefining the space for what you can offer?
We really do go through the process of redefining, reframing for our prospects what really moves the needle in terms of value creation in healthcare, and that it's not just CRM, it's not just a way to do dashboards, it's an integrated approach with a full solution, a healthcare relationship management solution that unifies those different concepts all into one very goal-oriented approach that also has specific solutions already configured, and you only have to do some minor adjusting. You don't have to go through the process of creating all your requirements, doing a big IT project, any of that. It's truly a quick, easy, straightforward activation that is much different than what was the status quo in healthcare IT of these long, burdensome, complicated implementations. So that combination of reframing what you're really in need of is healthcare relationship management, which truly understands what your needs are, and that our team, with the expertise and track record we have, we take the burden away from your group of IT folks who are already overtaxed, and we're able to plug this right in. And I don't want to trivialize what we're doing by saying, well, it's just this overlay, it's very simple. This has been huge amount of investment into the technology that makes it work so easily. But before HC1 showed up, to be able to bring together CRM and content about referral patterns and analytics on that, and full solutions that do things like help you grow referrals, and then ultimately the ability to have these public health insights, this is something that would take years and hundreds of people to try to get it done. So what we oftentimes hear is, oh my gosh, I can't believe that's even real. And then we're able to demonstrate that it is and refer to other customers that are benefiting from it. And it is truly differentiated. We don't really have other competitors who have started from the ground up like we did to construct this unique model with these different capabilities all in one solution. It tends to be more CRM that is more focused on generic and trying to apply that to healthcare, or it tends to be more of a reporting tool, an analytics dashboard tool, which doesn't connect all the way down to driving the action and accountability through the CRM like we have. So we do have a relatively unique, differentiated position in the market.
You certainly, we're not looking for client names, but maybe you can just give a few examples of clients like, after 12 months, we had a client whose costs went down by X, or who acquired X amount of patients. Maybe you can share some of that?
Sure, yeah, and I'm happy to share some specific examples. One that is very impactful related to this whole idea of delivering personalized service across lots of different providers that you're serving in the diagnostic laboratory space. We have a customer in Minneapolis area called North Memorial that had put in Epic, and they put in the Epic lab information system component as well. And they were having some growing pains with that system that was leading to some service disruptions for their customers who are providers that are depending on this lab result data to operate their practices. And there was a very large referral source that they had that was responsible for well north of 150,000 in profit per year as a lab customer. And the HC1 system was put in place at North Memorial to help them better monitor and engage with their customers. The HC1 system identified that there was a significant decrease in volume starting to occur with this provider, sent an alert to the individual who was the account manager for that provider, who proceeded to research what was going on, scheduled a meeting, went through all the issues that they were seeing and the game plan they had to go address and resolve those issues. And the reality was that referring provider was testing another lab as a replacement. And if it weren't for HC1, right away within the first week, they would have lost $150,000 in profit, which if you take that across the entire year and you think about the dozens of accounts they could have lost, that's a big impact. And while healthcare is about delivering services to improve people's health and impact mankind positively, that's why people go into healthcare. If there's no margin, there's no mission. So these healthcare organizations really need to deliver great service and also make sure that they're doing it in a way that's profitable. So basically, that one initial customer that they were able to retain paid for their first year of subscription services from HC1.
Health systems are moving forward. You probably know this, but Steve Klasko talked about this on my show. Acquiring patients is very hot right now. It's hot down at HIMSS. I know it's a hot area that you focus on as well. I really liked what I was reading about what you're doing with post-acute care facilities. You're looking to increase their referrals from PCPs and hospitals, and maybe you can just touch on that a bit more. I think it's something that the audience should know more about, and I'd like to know more about it myself.
So the post-acute care world is such a critical component to the overall healthcare environment. It's a place where you must continuously manage the way that you're caring for people, and you also now need to be reporting back to the referring provider on how things are going in more of a real-time basis. It's not good enough just to have a report at the end of the year that says this is how many readmissions we had. So we're really bringing a powerful new way for these post-acute care groups, these long-term care and skilled nursing facilities to connect in a manner that makes them truly become an extension to the referring provider, rather than just some other healthcare service silo that happens along the journey. And the first piece is there are systems that are commonly utilized to report out to the post-acute care groups which patients are discharging and therefore need a post-acute care option. And so HC1 is actually integrating into those systems and making it so that our customers can instantly have visibility into who needs a post-acute care service provider. And increasingly, the hospitals are creating these more narrow networks that are zeroing in on a handful of specific organizations that they're selecting to engage with. And so HC1 gives you that full loop of healthcare relationship management, where it's first of all efficiently onboarding and admitting new patients, and then also on an ongoing basis reporting out to the referring provider as well as the payer on how things are progressing with those patients, which ultimately leads to better quality, better outcomes, and gets you to the point where you can say in specific healthcare scenarios with specific diagnoses or treatment scenarios where you can start contemplating these more shared risk arrangements where you have a gain sharing opportunity. So that's in summary what's provided. In addition to that round trip, HC1 through our Provider View solution is also allowing you to look at a rich set of analytics on where the referrals are out there in the healthcare environment that you serve,
Right.
and where those referrals are currently going. And it gives you a chance to go and provide a better service to get more of those referrals going your way.
Now, do you see applying this type of technology to healthcare systems in terms of helping them with patient acquisition? I'm talking about, systems that haven't really done so yet, but are going to really, I think, in the future, start competing with other healthcare systems to sort of acquire patient populations.
Absolutely. In fact, I've got a big meeting with a very large healthcare system coming up at the end of this month on that very topic. They're losing some market share.
Yep.
And they are in a situation where they need to become more focused on adding new referral sources. And so HC1 is an excellent partner to help them with that. Ambulatory services are a huge part of the strategies of these integrated delivery networks as well. So we're absolutely very well suited to support that kind of activity.
Recently, Tech Republic ran an article on Uber Health. And the numbers are right now that about 3.5 million Americans, nearly 1 million children miss doctor appointments every single year because they don't have reliable transportation.
Mm-hmm.
So your company was mentioned in that piece. Are you working with Uber Health? Are you working with ride-sharing technology within your platform?
We've actually had that as a concept for a number of years now, and those services have matured to the point where they have partner programs that allow for that sort of thing. So absolutely, and that's a good example of an action that can be taken to drive a positive outcome in healthcare that isn't even all that high tech. It's just the standard thing of if I can't get from point A to point B to have my appointment, I won't be going. So absolutely, that's an area that HC1 is connected into and sees as holding great promise.
Brad, I want to finish up with a question from left field. I do this on most of my interviews. Look, let's just say I could snap my fingers and right here and now, you could have every single healthcare policymaker on the call, on the phone right now, and they're doing nothing other than listening to your words over the next 30 seconds. And whatever you tell them, they're going to do. So what would you tell them specifically that you feel needs to improve and to really happen to make healthcare better?
Well, we have a massive epidemic with more than 8.4 million people struggling with addiction to prescription drugs. And we need to roll out a national program that brings the access to that insight to every single state and makes it actionable, brings the intervention, the best practices to the table, both from a front end, reducing misprescribing, to the ongoing care management piece of ensuring that if somebody is getting a prescription that could be addictive, that they're being managed very actively, all the way through to the treatment area on how can you deliver a more coordinated, more seamless approach to treatment management and viewing and approaching that as a disease state that needs to be addressed in that way. My immediate focus would be to start with a national program that brings that capability to every single state, and we can drive huge positive change and begin to reverse the tide of the tragic number of deaths that just continue to increase every single year. That's absolutely where I would start.
Brad Bostic, CEO of HC1.com. Brad, I want to thank you for coming on to the show today. Just an absolutely refreshing conversation, a great back and forth. I'm glad that we were able to make this happen, and I'm really, really pleased that you were able to share your thoughts with our audience.
Well, thank you so much for giving us a platform here to spread the information about the good work that we're able to do with the healthcare organizations that are aligned with HC1, both at the provider and diagnostic lab level, all the way to the public health level. We're excited to have a value we can deliver, and the more we can get the story out to more constituents, the better. So thanks very much for having me on.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.